A recess at any time. The committee welcomes the public to this important meeting. While you are here, I want to point out to the members and the audience today that House Rule 11 provides the chairman of the committee that the chairman may punish breaches of order and decorum, including exclusion from the hearing. All participants will be required to avoid unruly behavior and inappropriate language. Expressions of support or opposition are not in order. I expect all parties to these proceedings to conduct themselves in a manner that reflects properly on the House of Representatives, as have every one of the hearings that we've had thus far on the pandemic. Pursuant to Rule 7D of the Committee on Oversight and Accountability, and at the discretion of Chairman Comer, Mr. Jordan, a member of the full committee, may participate in today's hearing for the purposes of questions. Further, without objection, I ask for unanimous consent for Mr. Frost of Florida, Mr. Gomez of California, both members of the full committee, to participate in this hearing for the purposes of questions. And without objection, so ordered. I now recognize myself for the purpose of making an opening statement. This is our second hearing regarding pandemic-era school closures. We're investigating the decision-making process behind school closures and the effects it had so that we can do better in the future. Inherently, part of that investigation is evaluating if the Centers for Disease Control and Prevention followed science as they knew it or learned it, or merely accepted outside guidance regardless of available data during its guidance drafting and publication process. This is part of the reason that we're here today, to determine to what extent the opinions and suggested guidelines offered by, in this case, the American Federation of Teachers during the CDC guidance process were accepted and why they were accepted. Americans are curious to know if the AFT access was in line with CDC past practice and if their influence had a positive or detrimental impact on America's children. While it's reasonable for the CDC to seek outside opinions, were some opinions accepted and others not considered? And why or why not? These are questions that we need to ask. To be clear, we are not here to attack teachers, the teaching profession, or suggest pandemic-era teaching was easy, because it was not. And we all know that. We're here to conduct an after-action report, establish lessons learned, so that we can better protect our children in the future and protect our children's futures. During this process, honesty is non-negotiable, and the facts should be facts, not political statements. Beginning in March 2020, in response to COVID-19, schools around the world began to close. Doctors and scientists didn't know a lot about the novel virus, and decisions were made based on whatever facts were known, and at the time, they were what was known to try and best save lives. However, it became clear, in fact essential, long before the beginning of the fall of 2020 semester, that schools needed to be, and safely could be, open for in-person instruction. It was happening. My children have benefited greatly in every way, academically, physically, and mentally, from their schools being open since the fall of 2020. And when the facts become clear, our decisions must change with them. It's important for students, important for parents, and important for teachers. Further, the facts and science supported the ability to safely reopen. While children could get and transmit COVID-19, it was rare. While children could die from COVID-19, that risk has been estimated as 1 in a million. Some estimates stated that children actually became 10 times as likely to die by suicide, a crisis exacerbated by school closures. And with a wide range of mitigation strategies, COVID-19 transmission in a school setting was low. Schools could have and should have reopened. And again, many did. The baseline question should have been, schools need to be open. Are we doing everything we can to make that happen? Unfortunately, many schools chose not to reopen, despite the science supporting safe in-person school practices. This all came to a head in February 2021 when the Biden administration and the CDC issued its first school reopening guidance entitled The Operational Strategy for K-12 Schools Through Phased Prevention. According to reports, when this guidance was issued, its recommendations would keep 90% of schools, including almost all of the 50 largest counties in the country, from fully reopening. Why? Primarily because of three recommendations. The use of community spread rates to determine reopening, a requirement for routine screening testing, and 6 feet of distancing instead of 3 feet. None of these based in sound science at the time, yet all directly supported by the AFT. Community spread does not reflect school spread. Data showed that it appeared safer to be in school than in the community in many, many cases. So if the goal is to get kids in school, and it's essential for America as we determine things to be essential or not, then why was the recommendation to follow the community spread data and not the in-school spread data, which is actually the environment in question? The AFT is, of course, allowed to have an opinion. I respect that. But opinion should fully explain how the opinion was reached. This is how science works and how science is debated. Teachers teach science. In an email on February 11, 2020 to Director Walensky from AFT staff, AFT takes issue with the current CDC language that stated, at any level of community transmission, all schools can provide in-person instruction. Seemingly to weaken that statement, AFT proposed adding, in the event high community transmission results from a new variant of COVID-19, a new update of these guidelines may be necessary. The CDC obliged and added that edit to the final guidance. Why not, in the event of a high in-person school transmission rather than community transmission? They're two different. In an email to the president of the AFT staff prepared a document for the president for a February 1, 2020 phone call with CDC. AFT staff wrote that the CDC should support the adoption of screening testing. In notes provided to the President Weingarten, before the same February 1, 2020 call with the CDC, AFT staff wrote, emphasize 6 feet of distancing. The guidance is fairly good on 6 feet or more of distance. It could be made stronger by rebutting directly school systems that are using lower standards to keep students in school. Let me say that again. Basically, AFT objected to schools using less than 6 feet of social distancing so that kids could return to school. AFT's support for these unscientific mitigation policies calls into question why it was offering scientific advice to the CDC in the first place. The scientific expertise of the AFT is called into question, and also called into question is the high level of access and influence the AFT was provided by the CDC. In the AFT letter to this subcommittee on April 19th, lawyers wrote, quote, releasing guidance on how to safely reopen schools without attempting to address the concerns of these educators would not only be irresponsible, but also futile, end quote. The lawyers continue, in short, the failure to consult would have been foolish and self-defeating, end quote. To me, these statements sound like a form of intimidation. Is this more political than scientific? Of course, in the letter and prepared statement that President Weingarten submitted today, she mentioned former President Trump 12 times. As best that I can tell, President Trump had nothing to do with the crafting of AFT guideline recommendations. That's the topic today. The purpose of this committee is to examine the procedures followed, the decisions made and why, what motivated decisions, and what worked and didn't work, then ultimately, I would hope that we can produce a product, bipartisan, that will guide future generations so that we may have the ability to predict the next pandemic, prepare for it, protect us from it, and maybe even prevent it. And in this case, maybe even be able to successfully maximize our children's education, especially in-person education, not just for some of our children, but rather all of our children across this country. I pray that today's hearing will produce some of the necessary facts and evidence that this subcommittee may utilize going forward in order to achieve our altruistic goals. I would now like to recognize Ranking Member Ruiz for the purpose of making an opening statement.
Thank you, Mr. Chairman. The COVID-19 pandemic has taken a heavy toll on our nation's students, both inside and outside the classroom. Nearly 230,000 children nationwide lost a parent or primary caregiver to the pandemic. Adding to this loss, job loss, economic hardship, and food insecurity weighed heavily on families across the country. These stressors, in combination with the prolonged suspension of in-person learning, have had a profound impact on our nation's youth, their mental health, and their academic performance. According to a 2021 CDC study, nearly 45% of high school students suffered so severely from feelings of sadness and hopelessness that they were unable to engage in regular activities. Nearly 1 in 5 students seriously considered suicide, and 9% of surveyed teenagers actually tried to take their lives during the previous 12 months. These are alarming statistics, and as a physician, an emergency physician, and a father, I am deeply concerned about this growing mental health crisis among our youth. It is crucial that we address this as well as the startling declines in learning caused by the prolonged suspension of in-person learning and the psychological trauma of the pandemic and losing a parent. According to a January 2023 McKinsey report, we've been set back 2 decades of progress in learning because of this pandemic, and it may take until 2050 for some students to recover. So now is the time to get students the resources they need to live and learn healthily and safely so that they can succeed now and into the future. The mental health crisis our students face and the acute learning loss they suffered demand a response that is driven by data-informed solutions that put people above politics, not extreme budget cuts that threaten our children's health, safety, and well-being. You see, when we invest in education and prioritize our children's health, we see the results. Under the American Rescue Plan and the Biden administration's leadership, we doubled the number of schools open for full-time in-person learning thanks to bold investments in education and school infrastructure. In fact, just 1 day after he was sworn in to office, President Biden issued a sweeping executive order directing a whole-of-government approach to get schools safely and responsibly opened. This leadership, the American Rescue Plan's bold investments, and strong guidance created with input from more than 50 organizations, including parents, teachers, nurses, and superintendents, helped get students back in the classroom sooner and protected our communities from a deadly novel virus. It is because of these investments and this leadership that we were able to overcome the previous administration's COVID-19 response failures and inaction that left our nation and our classrooms unprepared to combat a global public health threat. Failures such as downplaying the pandemic, calling it a hoax, a political ploy by Democrats, not urgently acting to reduce transmission, not honestly communicating with the American public, and not effectively equipping our schools with the necessary resources to stay open. These actions put high-risk communities in harm's way, led to an estimated 130,000 preventable American deaths, and resulted in the prolonged suspension of in-person learning. These failures should have taught us all a lesson about what happens when we leave our schools and our communities under-resourced, under-equipped, and vulnerable. And yet, here we are holding this hearing today along the backdrop of the Republican extreme budget plan that makes reckless 22% cuts on critical education and healthcare programs that serve Americans' children and families. The extreme Republican budget would have disastrous consequences for our communities, such as removing 60,000 teachers from schools serving low-income students, eliminating more than 101,000 child care slots, excluding nearly 1.2 million children and mothers from essential nutrition programs, and decimating life-saving mental health programs. This doesn't help our students suffering from mental health or struggling with their grades. It makes it worse for them and their parents. Right now, America's children need our support. They need resources to make up for lost classroom time, overcome struggles with mental health, and live, learn, and grow in a healthy, safe environment. Ripping away critical funding and focusing on and prioritizing partisan allegations that seek to vilify our nation's dedicated teachers will get us nowhere in addressing the challenges our nation's children face. Instead, let's cut the partisan allegations. Let's get down to business and let's prioritize our children's health and well-being both inside and outside the classroom. And let's prepare our schools for the next deadly airborne pandemic to save lives, reduce transmissions, and keep schools safely and responsibly open. I yield back.
I thank the ranking member. We'll be able to have these conversations again when that's the topic. And so I appreciate you setting the stage now. Our witness today is Ms. Randi Weingarten. Ms. Weingarten has served as the president of the American Federation of Teachers since 2008. In this role, she oversees a union that represents more than 1.7 million members, including teachers and other school-related personnel. Pursuant to the Committee on Oversight and Accountability Rule 9G, the witness will please stand and raise her right hand. Do you solemnly swear or affirm that the testimony that you are about to give is the truth, the whole truth, and nothing but the truth, so help you God? Thank you. Let the record show that the witness answered in the affirmative. The Select Subcommittee certainly appreciates you being here today, and we look forward to your testimony. Let me remind the witness that we have read your written statements, and they will appear in full in the hearing record. So please limit your oral statement to 5 minutes. As a reminder, please press the button on the microphone in front of you so that it is on and the members can hear you. When you begin to speak, the light in front of you will turn green. After 4 minutes, the light will turn yellow. When the red light comes on, your 5 minutes has expired, and we would ask that you please wrap up. I now recognize Ms. Weingarten to give an opening statement.
Thank you, Chair Wenstrup, Ranking Member Ruiz, and members of the subcommittee. I thank you for the opportunity to discuss my members' work during the COVID pandemic. Teachers work creatively, often past the point of exhaustion, to teach and reach their students, like Kara McCormick Lyons from White Plains, who's here with us today. I'm going to ask the three of them to stand in a minute. School bus drivers drove their routes to drop off meals and learning materials, like Lisa Rogers from Albuquerque, and school nurses like Beverly Scott from Cleveland navigated the challenges and the uncertainty of the global pandemic. Would the three of you just stand to be recognized? And I appreciate what the chair said about teachers and what they have done during this period of time. Now, if you have, and I know it took some minutes, but if you have educators in your lives, you know that their priority is their students, to create a safe environment for all children and to prepare them for life, career, college, and citizenship. We know that kids learn best in person, so opening schools safely, even as the pandemic surged, guided the AFT's every action. And I'm grateful to set the record straight. From the earliest days of COVID, the AFT knew that safety was the pathway to opening schools and keeping them open. We, along with parents and administrators and health officials, we needed clear science-based guidance to keep students and staff safe in school. And yes, it made sense to consult with the CDC, and it was not only appropriate for the CDC to confer with educators, it would have been irresponsible for them not to. And the CDC conferred with more than 50 organizations about the guidance. But before the CDC, and frankly, neither the president at that time nor Betsy DeVos would confer with us. But we tried to do whatever we could. We released this report in April 2020, a common-sense, science-backed plan to open schools safely. That same month, we worked with John King, the former education secretary, to focus and combat learning loss. 2020 was chaotic and terrifying. The previous administration downplayed the pandemic. Failure to protect Americans had unbearable costs. It's not just the 1.1 million Americans that died of COVID. Black children died at almost 3 times the rate of white children. 245,000 children were orphaned in America. And members of my union died as well. Gabriel Gale was a 4th grade teacher who was pregnant with her 2nd child when she died. We lost Holly Ann Hoover, a nurse, Anthony Harrell, a school custodian, and so many more. And this is what the AFT did. When the Strategic National Stockpile unstocked, we bought $3 million of PPE for our nurses and for our teachers in schools. We ran vaccination clinics. We convened virtual town halls that brought parents and educators and mental health experts together. We spent $5 million on a back-to-school campaign to get people back to school, everything from developing reopening plans, back to school fairs, door-to-door visits with parents, billboards, radio ads, etc. Our priorities were to open schools safely, to keep students and staff and families safe, to focus on students' social, emotional, and academic well-being, and to get the resources for this. We were fighting for better ventilation, yes, for COVID testing, and for the tools that we needed. And the same was true with parents. When President Trump left office, 46% of schools were open for in-person instruction. Between the American Rescue Plan and the work done by the CDC and other agencies, and by governors and education officials, parents and educators, including our union, we went from 46% of schools open for in-person instruction in January 2021 to close to 97% open in May 2021. Now, teachers want what students need. Let's work together now to help kids recover and leap academically. Let's expand community schools. Let's increase experiential learning and career-connected learning. Let's address educator burnout. Together, we can overcome the effects of this unprecedented pandemic, and I welcome